you, Dr. Fatma. Welcome to the session. Yeah, you are a
Yeah.
little bit audible, but a voice is a bit slow.
Okay, I'm try to speak louder. Am I audible now?
Yeah, it is quite better now. Yes. Thank you so much for
Okay.
joining. Welcome everyone on the session today. Welcome from the Med Exam Expert. We will be having this session on MRCEM Primary. It would be an introductory session. And we will be discussing, like basically Dr. Fatma will be guiding us on how we are going to conduct the complete course for MRCEM Primary May 2025 batch, and what would be the weightage of all the topics, the questions that basically come in the exams. So we are going to start. I would just request all the course participants who have already enrolled in the course, they should please properly introduce themselves to their mentor so that you can, interact properly, and then alongside we can get to know that what are their goals, and then we can start with the later part of the course. So one by one, we can start whenever the mentor will say. So over to you, Dr. Fatma. Thank you.
Okay, thank you, Anam. Thank you so much. So, hello, my name is Dr. Fatma Zahra, and I'm your MRCEM primary exam mentor from the Med Exam Expert platform. And I hope you all are doing great. And first of all, uh, I want to say welcome all of you, especially to those candidates who are now become our official candidates, because you are going to appear in this May attempt. So welcome to you all. And today's session is basically conducted for two reasons. Okay. So the first one is to introduce our schedule, to introduce our website with you people, and the other thing, which is the main purpose, is introduce or to know about our candidates. Okay. So after discussing about our schedule, we will um, uh, uh, we will give your introduction. Okay, we will. Okay, so let's move towards our first slide. So now I'm going to tell you about how we'll commence our course. So our course is basically the having some online interactive lectures and their recorded access. Why they recorded access? Because many of you may remain busy in your duties, in your daily work. So we also give you some recorded access, and the purpose of online interactive lectures is you attend the online lectures, and after the online lecture there is some Q&A sessions in which after the lecture you ask any question regarding the lecture, about that lecture or any free. Okay, so we are going to arrange online lectures, and we will also give you their recorded access. Second thing is Telegram group. The Telegram group is basically is for any query and discussion. If you are unable to attend the online lectures, and if you have any questions after the lecture, so you can question in that group. Okay, and the second purpose of that group. Okay, so am I audible? I think.
Yeah, you're audible, Dr. Fatma.
Okay. So the second thing is after every class, okay, after every session, our team or yes, our team will post some quiz questions, okay, like 10 to 15 questions regarding that lecture or maybe regarding the previous lecture, and you have to answer that questions. So in this way, we will assess our students, and we will assess them that is they are able to understand our lectures, or if we are able to give the proper information regarding that topic. Okay, so post class quiz sessions will also arrange, and then weekly assessment of the students. When we are we will pose that questions, then after your answers we will assess you, and our and this whole course is basically of 3 months course. Okay, so because you will going to appear in this May, I think, so we will have to cover this whole lecture, within the 3 months. Okay. Now I'm going to tell you about some information about the primary examination. Uh, so basically, the MRCEM primary exam is having 180 questions, and you have only 3 hours to attempt them. Okay, so it means that you have to take in one go with no breaks in between. You will give 1 minute for each question. Okay, and if we are going to discuss about the mark distribution, so anatomy will get 60 questions, physiology 60 questions, pharmacology 24 questions, microbiology is having 17 questions, and pathology 9 question, evidence based 6 to 10 questions. Okay, so you when we are talking about the mark distribution, as you people see that anatomy and physiology got 60 and 60 questions, so it means that anatomy and physiology are carrying maximum mark. Okay, okay, so more than half mark. So we have to focus on anatomy and physiology. And one thing you people should keep in your mind that anatomy and physiology, as anatomy and physiology got 120 questions, so you have to clear your concept. If you people prepare anatomy and physiology just for that, we just want to pass this exam, you will stuck in your intermediate or your second part of this exam. Okay, so you have to clear your each and every concept. So that's why we will arrange interactive classes and also the Telegram group. Because if you people are not going to clear your concept, you will definitely stuck in your intermediate and you will not going to pass your intermediate exam. Okay, so it's not about just primary exam, it's also about your exam as well. Okay, in the coming slide, we will further show you. Okay. Okay, wait a minute. Okay, in these first slides, we will further show you the marks distribution. Like anatomy have head and neck, central nervous system, cranial nerve. So 8 questions come from head and neck, 8 questions come from CNS, 8 questions come from cranial nerves. Okay, so 9 questions from upper limb. So you can take the screenshot of this marks distribution, or our team will also share this mark distribution in Telegram. But you have to clear that how one topic is important, how much one topic is important than the other topic. Okay, so you have to give the specific time to that topic. Like if we are going to discuss about pharmacology, microbiology, pathology, and evidence-based medicine, as you people see that evidence-based medicine have only the 6 to 10 question weightage. So why we will give so much importance to the EBM? Okay, so you have to focus on you have to focus. You will have to focus on anatomy and physiology, and then pharmacology and microbiology. Okay, because they have more weightage than the other. So now we will discuss to our schedule. So let's talk about our schedule. We divided our schedule within these 3 months, and we have to cover our schedule before May. And our first class will be on 3rd Feb. Okay, so on 3rd Feb, our first class is about upper limb, because upper limb is quite lengthy topic, and so we divided the upper limb in the two parts, like part 1 and the part 2. So on 3rd of Feb, we'll cover half of the upper limb, and on the 6th of Feb, we will cover second part of the upper limb. Okay, on similarly, we will arrange 7 to 8 um, 7 to 8 classes per month. So as you people see, nearly the start of the March, we will cover anatomy, and nearly start of the April, nearly almost 3rd and the 7th April, we will cover our whole physiology. Okay, then the 7th and 9th April, we will cover pharmacology, because pharmacology is also a very extensive topic, and 27 questions comes from the pharmacology. So it also have the weightage of marks. So we will cover them in 2 days. um, and the days between these two lectures, like 7th and 9th, you have enough time to study by yourself, and then ask any question in our groups. Okay. Then 12th and 14th of April, we will cover microbiology. So because as you people already know that micro is also a very extensive topic, and in micro we will have to cover bacteriology, virology, parasitology. But in MRChem primary, there is an other topic which is the basic principle of microbiology, and I think almost 6 to 7 questions will also come from that topic. Okay, so we will also cover that topic uh, within these 2 days. Then pathology we will also cover um, during the 17th and 19th April, and 1st of April we will cover the EBM, and this is our last official lecture. But uh, as your exam will be, I think, on for 7th to 9th May. So the days between the 21st of April and the May, we will arrange some mocks, and we will arrange some your test sessions or quiz sessions, okay, which are quite exam oriented. So we will assess you, we will also prepare you, and in this way we will cover our whole course. Okay. Forward, we already discussed these marks distribution. So that's all for today from my side. If you have any question, you can ask in Q&A box. And before the questions, uh, I want I want that Anam will explain you about our website as well.
Yes, absolutely. So thank you so much, Dr. Fatma. We have covered that how we will conduct the course, right? Thank you so much, participants, for listening carefully. And now we will be discussing that how we are going to provide you all the course content on the library, all right? So it would be basically all your material. We will be sharing screen in a while and showing you a glimpse of what our website will look like, all right? So just give me a minute and we'll be there real soon. Dr. Fatma, you can stop share so that I can share my screen.
Okay, sorry.
Yeah. Now. Yeah. Okay, thank you. So, all right. So I hope that my screen is visible now.
Yes, it is
All
visible.
right. So, okay. So this would be your basic overview of the website. We will have a homepage here, which is called as a user dashboard on our website. Once you are enrolled in a course, you will get access to this. Like we have our subscribed courses here. So if I talk about MRCEM primary course, you will just have to click on the view more. Once you click on the view more, the website will load and you will enter into the main page, or you can say user dashboard screen of your course. All right, so we'll let it load. I guess there is some issue. I will just reshare the screen. Just give me a minute. I'm sharing it back now. So here it is going to be available in a minute. Yeah. So here we are. Once you are done with the, you are into the page, you will be able to see the course here, right? So now what we have done on a website is that we have divided the course into proper course material, all right? So you can see that in a course material section, you will be able to see all the course contents, okay? So let's first open this course content and see how it is going to work. In a course content section, you will always find any of your particular PDF, your PPTs, or relevant material of that topic into this section, all right? So everything will be like module-wise saved here, and you will be able to see it. Guess it's taking a bit long to load, so let's wait for it a while. All right, everyone, so here you can
I think there is some net issues or from your side.
Yeah, there was
So
some
you are
issue.
not.
Yeah, there was some issue in the Zoom app, basically.
Okay. Okay.
I'm just connecting back in a while. Just give me a minute. Thank you so much.
Okay, sure.
All right, so we are back. Really sorry about that. Apologies. There was some issue with the Zoom updation and it's done now. Sorry about that. So we will have basically the content here. You can see our website is alphabetically aligned. So if we have the content for anatomy, all papers, all the module things that relevant to anatomy would be uploaded here in alphabetical order. And with the key that is Control F, you can search anything for the shortcut as well, right? So you will have it all here section. Okay, it all material ends. Below that starts microbiology content. All right, so I'm just going up quickly and scrolling up and going to minimize the anatomy so that you can see that all the other content is already available here, right? So this way you can just drop down and find for any of the relevant files or the notes. So let's see how these notes will look. Let's say, for example, if we open up the ankle joint, so this is how it is going to be. You will have all this, notes on the left side of your website, and the preview, it will be opening up the center of the website, and this is how it is going to work. I guess there is some internet issue today here, so apologies for that. It's taking a bit long. It will open up and you can see the notes. They are properly branded and placed here. And good point about the notes here is that notes are skimmed properly and only most important things are placed here, right? So if we talk about the ankle joint note, so you can see here what is most relevant would be here. All the most important information is skimmed and placed here. And this is like sort of short flashcards. So what is happening here is that it is very helpful for you in terms that it is going to be only to the point thing that is too much, you can say, helpful, skimming out all the unnecessary information so that you can easily study about it. Now, the second module here would be session recordings. All the session that Dr. Fatma will take for you will be, recorded and uploaded here, right? So, okay, Dr. Bushra, we will reply to your answer. Ariba from our team will guide you that how to, log in the website, okay? So we will be answering all the queries one by one. So for now, session recordings will be here, right? And because it will be empty right now because we haven't taken any official classes yet. They are ought to start from 3rd of February. So we are going to put all the session recordings here in this section, right? Coming back towards course dashboard, you can go and search for any FAQs like what is the fee of the course and all stuff related to the course, basically MRCEM primary information. So it will be all here. Now coming towards the down section, there are Q banks available. By Q banks, I mean all the questions around, I guess, 3,000 or 3,500 plus questions are available here. So let's open up this Q bank. In a Q bank, there would be variety of questions. It is not like a mock exam which contains only 180 questions, but bundle of questions would be there topic wise, right? So module wise, everything would be listed and be placed here. You can see that whenever you come to any Q bank on our website, you will be having these options. Once you click on practice now, you will be taken towards this screen where you have to choose whether you want to go with the revision mode or you want to go with mock exam mode. Okay, by revision mode, you mean that if you are just visiting a website and you are just wanting to have a glance of what topic and website looks like and how it functions, so this would be a revision mode. Let's open up a revision mode to understand this. Okay, so in a revision mode, basically you can have multiple sort of questions. Okay, whatever you want, you can select that and practice on that. But if you select the mock mode, that would be time bound, and you have to finish the question within that given time duration. Like let's say, for instance, if you select 180 question to practice, you will have to finish those 180 questions within 180 minutes. Okay, so this is how it works. But in the revision mode, you can see here, you see, in a revision mode, you can either select all sort of questions which you have never seen before, which you have never attempted before or have done wrong before, for instance, and all sort of you can say all of your modules as well. Let's say if I select all here, there are 1,178 questions altogether coming for these topics, right? But if I only select upper limb, then only 245 questions as we have stock for upper limb here would be your practicing base now. So if we only want abdomen, we can select that. If you want upper limb and abdomen combination today to practice, we can do that. So it is very handy and very helpful for all the candidates. Whichever topic you will want to select and practice that day, you can do that. And whichever sort of questions, like let's say if you have practiced abdomen yesterday and you want to see your wrong question, what you have to do is select have done wrong and abdomen, okay? And you will, because yet I haven't practiced anything, so it is not coming up, but you will have to select here have done wrong and select the abdomen, and you will be opening up and going to the view where you did the abdomen questions wrong, and you can just go and practice back them. Okay, so this is how handy and helpful it would be. Okay, so this is all about question bank. You can come here and you can practice as much as you want and as many times you want. It is not a limited thing as well. Now going back towards the user board, dashboard, I will just go back to my course, and now to final thing, that is mock. Basically, a course material is for right now containing all the primary notes and will contain session recording. But just to inform you that we will try our level best to find all the recalls, and it will be placed here in the course contact section under all the topics. So all the recalls will be available, like whatever years, whatever paper we will find, we will put and place here for the candidates, so that they don't have to go to the random websites and search for them. We will make them, we will align the recalls and just put it here for you all. Okay. And then coming back towards the mock exam, in a mock exam, by the name, it suggests that it will be like a real exam. So only 180 questions in a paper there, and there would be directly a paper, no option to choose like the number of questions, because it is mock, so it is supposed to be like a re-exam. So you can see that in mock exam we have at most like 4 mocks placed there. So if we go toward mock 1, I'll just open up and show you that you have got proper instructions like exam time allowed, maximum time, passing score, and your total questions, and then few instructions there which you can read. You can see your previous attempt as well. By the way, previous attempt, you can say the choice of watching the previous attempt help you to see that how better you're improving every day after taking the session, how good you have learned. And from your previous attempt, you just have to compare yourself and see where you're standing now. So this is also very amazing. If I'm going to start it, just to show you a preview. So you see here, 180 questions here. At the very leftmost side, you can see 180 questions. And by the way, these mocks are being chosen very carefully, and they are almost near to real exam. Okay, so you can just start practicing here. For example, let's say I just did this because I'm not a doctor. Basically, I'm just going to give you. So I'm just selecting any random options. Next, for instance, let's say I have just done my 180 questions and I'm going to submit it from here up right corner. Okay, I just click my submit button. It would ask me to enter my name for this attempt. I will say attempt 1, and I will just save and continue to the results. So it shows me properly that what I have done. So I just luckily got 1 correct and all other wrongs. So what I'm going to do is I'm going to see answers. What happened here? You see, with answer, there's are all explanation, including your images, so that once you are in a mock, you are going to love this thing. Like all the questions will be there, along with their explanations, along with the correct answer. So this is how you are going to basically, have all the complete help from our website. This was all about our website. I hope that everyone has the view well, and this is all about it. Now, as Dr. Fatma have mentioned that we are going to start from 3rd of February, so I would like everyone to join us. And anyone who would like to have any particular queries about the website or the course enrollment, they can just contact our team. We are available, and Dr. Fatma is there to help you, all right? And we will be helping you in a very best possible way. In our open free guide group, Dr. Varda Shakil is working there, and she's providing free guidance to the candidates as well. But definitely, when we go towards the paid course, definitely entire team is putting back in effort. I'm right now sitting in office at Med Exam Expert, so there is a huge team. We are putting our efforts. We are trying to do best for you. And along with Dr. Fatma, we will try to make sure that we give all the core concept of American primary to you guys, and along with all the recalls, which are very compulsory to attempt. All right. So this is all about it, Dr. Fatma. Now you can just check to the comment sections, and one by one, we can just answer the queries. If something is relevant to the admin team, I will answer. And if any query that discusses the study part, you can answer that. Okay. So over to you, Dr. Fatma.
Okay, Anam, thank you so much for giving us the whole information about the website. Okay, so there is a question about can you be more specific about what do you mean by the upper limb 1 and the 2 and the lower limb 1 and the 2 and the physiology 1 and the 2 and pharmacology 1 and 2? Okay, so basically the topics which are quite extensive, like upper limb, lower limb, or or the pharma, which is quite extensive, it is not possible to cover it in one day. Okay, so it's quite massive, messy if we cover them in one day. And so we divided that topic in 2 days. Okay, so we divided that topic in 2 days. So you people, um, uh, so it's more easy. It's quite more easy for me as well as you to engulf that knowledge, and it's more easy for me to give you the whole knowledge about that topic. And two means that we divided that topic, um, we did that topic in 2 days. Okay, so 1 and 2 means uh, that we will cover within 2 days. So the other question is website link. It's related to Anam. Anam will share.
Yes.
Okay.
All right. Yes, sure. We are just dropping the website link here
Okay.
soon. And also, there is one more query by some Zoom user that do you recommend using your app or website? So I would answer this. If you're a person who is very comfortable with the mobile screen, then you should opt for app. No problem at all, because that is also working really fine. Okay. I could have shown the preview if I can share the screen of my mobile. You can use that. That is definitely working really similar to what website I showed you there, right? If you are thinking that you are a person who wants to sit in front of a desktop or a laptop and open up the things in a bigger screen like I am, so you are definitely going for laptop. But if you're busy and you really want to skim through the things, you can just use your mobile app. That's totally fine, because both the things are same content is uploaded on the both things. I hope this answers the
Okay.
question.
So there is, yeah, Anam, thank you so much. So there is another question. Which topic will you cover in upper limb part 1? Okay, so we divided the upper limb in two parts. So the shoulder, pectoral region, and the arm, and some part of the forearm will cover in the first part, and in the second part we will discuss about the remaining part of the forearm and the hand, and the most important is the clinical from the upper limb. Okay, so that will be discussed in the second part. So I think there is no question. Yeah, it's a paid
Yeah.
app, right?
Yeah, okay. Let me
Okay.
answer to that. Okay, yes, you see that basically the course or the app is a paid enrolled app. Okay, you can say it has a fee. It's basically relevant to the course. Okay, we are putting up all the materials there which you are going to use for the course. Basically, app is not paid. You can just download it free, and you can even subscribe to our free courses and resource as well. But definitely the course, which will be live course based, and more than 20 plus sessions on Zoom will be taken by Dr. Fatma. So definitely there is some remuneration involved in that. So that is a paid course, of course. But app is free. You can download it from anywhere. We have some free resources there as well. We have free paid guide group on the WhatsApp as well, on Telegram as well, where you can practice question. But obviously, if you want to go into the depth and details, and if we are taking time from such a person like Dr. Fatma or any mentor, definitely then it's a paid course, right? So that, I hope that answers the question. But app is totally free. You can just visit the Play Store and download your app from there, okay? And practice the free library as well.
Okay, thank you, Anam. So before moving toward the
Okay,
introduction part of
yeah.
our session.
Dr. Fatma, I would just like
Yeah.
to add one more thing that because we understand and we appreciate all the participants who have joined today, and most of them have joined our course already. So I would just like to say one thing: if anyone would like to join us, we are accommodating candidates, and specifically from Pakistan and KSA and all the people who are, we know that worldwide people are in economic crisis. So anyone who would like to join us, we are going to help you out with little bit discount as well, and whatever we can do for doctors, because this platform is specifically for doctors, and that's the motto of the company, that we are helping you out. So anyone who would reach us, we will definitely accommodate you. It's not like those subscription who are giving it on a fixed rate or something like that. No, we are going to accommodate each and every one of you. If anyone would like to join, you are more than welcome. We will help you all, okay? Thank you so much. Yes, Dr. Fatma, please continue.
So thank you, Anam. So before going towards the introduction part of our session, I'm glad if you people tell us or share with us your name along with the designation, and along the designation, you can also share us the year of your graduation. Okay, so just you can just turn on your mic or your camera and introduce yourself. Okay, so okay, yeah.
Yes, everyone is encouraged to do that. You can just, even if anyone is not available on camera right now, you can just open up your mic and you can introduce yourself. You can ask any query. If you have any other query, like regarding to MRCEM exam, you can just ask them through the voice note. Okay. Yes, Dr. Faiza, you can write down in the chat box as well. And any other participant, meanwhile, if they can turn on their mic and if they can ask, they are very welcome to ask. Yes, Dr. Faiza, you can just write down your query into the chat box. No problem at all.
Hi, may I know what's the subscription price for this course?
Sure, doctor. About that, I would just like to tell you that currently we are offering the course at very minimal price, like 22 live sessions of 2 to 3 hours each, and it is going to be just around 200 USDs. But if you are someone who really needs, a little bit of scholarship as well, or a little bit of, off, we are also giving discounts as well. For the detail of that, Ariba from our team is available in the chat box. She will be guiding you, and the total subscription fee is 200 USDs. And definitely you are going to get good discount as well if you are interested to join, okay? Okay, Ariba can connect with you and you can share your contact detail so that she will guide you dedicatedly, all right? Okay, Dr. Fatma, I guess Dr. Faiza has written her query in the chat box. If you can just go through it.
Okay, Anam. Hello, I'm Dr. Faiza Masouda Ahmed, and I'm from Bangladesh, and I'm a doctor currently working in CCU. My session is 15 to 16, so I have done my MBBS 2 years back. Currently, I have also passed my PLAB. Okay, excellent, and got my GMC registration. Okay, got my GMC registration few days back. So, very nice. It's if you already passed the PLAB exam and you got the GMC registration, then this you will easily pass this exam. Okay, so second one is Dr. Zahra Zahoor from Karachi, Pakistan. Currently in Karachi, Pakistan, graduated in 2023 and currently working as RMO in emergency medicine department. Very well. Okay, so I want to tell you something, that if you are already working in emergency medicine, So it's really beneficial for you because this experience will help you a lot. Okay. Okay, and there is Dr. JP Nirojan. Above is the number of Riba. Okay, okay. I'm Dr. Kiran. I'm FCPS Emergency Medicine, currently working in Kuwait. Excellent. Okay, and I'm Dr. Faiza Masouda Ahmed, and I'm from Bangladesh, and I'm a doctor currently working in CCU. And my session is 15 to 16. I think I already read this. Thank you so much for joining us. And okay.
Yes,
Okay,
Dr.
Dr.
Fatma.
Karam, I am from Turkey. Yeah,
Yeah, go ahead, please.
okay. Dr. Karam, I am from the Turkey and I am emergency medicine resident at my 4th year and I want to clear my 25th at first enter. Okay. And then there is Dr. Bushra, graduated in 21 and done her house job in I think 22. And after that, I clear part 1 gynae and now I have appeared in this exam because my family moved to UK. Okay, okay, Dr. Bushra, very well. And then Dr. Zaira Zahoor from Karachi, Pakistan, graduated in 2023, currently working as the RMO, Emergency Medicine Department. I think the comments are repeating again and again. Okay, I think that's all for today. Okay, there is
Yes, thank you so
Dr.
much, Dr.
Nirojan
Faiza.
Ashmi.
Yeah, Dr. Kareem, Dr. Bushra, Dr. Kiran, Dr. Zaira. Thank you so much, Dr. Nirojan. Thank you so much. I guess most of the candidates, they have joined the course, and who haven't, thank you so much for your introduction. And thank you for the joining course and trusting us. We will make sure that it is going to be an amazing journey, okay? There is another question from Dr. Faiza in chat box, Dr. Fatma. You can check that, the
Okay,
most
okay.
recent one.
Okay. So the question is, what if I'm not working in emergency department? In Bangladesh, most of the private hospitals do not take females in emergency. And can you tell me, does ICU and CCU experiences also count in? Yes, ICU and CCU. First, the ICU and CCU experience is also countable. Okay. And the second thing is, if you are not working in emergency department, doesn't matter. First you have to clear your exam, then you will join any hospital or department in emergency department, and if you are not able to get job in emergency department, then in any department um, the experience of any department will count. Okay, so that's not matter. Okay, I think Anam, it's enough for today.
Yeah, I guess that all the queries have been answered, and thank you so much everyone for joining us. And it was really good having interaction with all of you. And all the best to all the candidates of MRCEM. We as a team med exam expert are always here to help you all. And we will be providing you the best thing, whatever is possible with us to do for you, okay? So stay connected, stay tuned. If you have any questions, you can just come to our website and you can just ask in that chat box as well. So we have a team there as well, live team attending to that, and they can also respond you back immediately. So for today, I guess this is it. And on the 3rd of February, to all the course participants, we will be meeting for the first session, and that would be for the course participants, and it is going to be upper limb. So till then, we will be meeting in the study room based on Telegram. Till then, goodbye to everyone, and I hope that you had learned and about the course, all the knowledge about the course. Thank you so much, Dr. Fatma.
Thank you,
Bye,
Anam. Thank
everyone.
you, everyone. Okay.
Thank you. Bye.